Okay. Hi, everyone. Western Mass Wonder Woman here with video 2 from my cancer journey. And I need to get a webcam because this is horrible. Um, my phone doesn't have enough storage anymore, so it has stopped allowing me to take videos. And yeah, so now I have to use this and this. And I apologize. But I wanted to get the information out and I wanted to keep up with the videos. So this is what we have to deal with for right now. So, video 2, I had my oncology appointment today. So last week I met with the surgical oncologist, and that is the one who physically takes the cancer out of my body, one way or another, either via lumpectomy, followed by radiation treatment, or a mastectomy with no radiation. Um, those are the basic parameters that I'm looking at for treatment right now, for surgical treatment. The medical oncologist that I met with today is the one who sort of handles a lot of that other stuff, like which kinds of treatment I'm going to get afterwards. There's also a oncological radiologist or radiologist, whatever. There's a specific cancer radiation person. So there's a whole bunch of different people in this team, which is nice because I have a team. Cool. Um, but each team has different pieces of the puzzle and different bits of information to give. So today I got some different information, some newer information, which was helpful. One thing that was explained to me today, which I had a big question about, and most of the people that I have talked to and shared this with have asked about, like the first thing out of people's mouth and was the first thing in my brain is, what stage cancer do I have? Because everyone knows, you hear stage 4 cancer and it's horrible. You're like, okay, stage 4, it could be like stage 4 cancer of like your fingernail, and you're like, oh my God, I'm going to die. It's horrible. So, yes, that is the definite scare and concern. Apparently, it takes a lot more diagnostics to figure out this stage, which makes sense once she explained it. So, right now, my diagnosis is invasive ductal carcinoma grade 2. That is the grade, not the stage, the grade, which is the size. So, it is currently the size of a sugar cube, which isn't bad. That's reasonably small. And based on the size, they don't suspect that it's been growing in there forever or that it's not very fast growing. The surgeon last week said that this was a walking cancer, not a running cancer. So that's also good news, which means, that's why I wasn't rushed into surgery like this weekend or anything. So it means that there's a little bit of time to get these further diagnostics and figure things out. So these diagnostics, today I had my blood drawn for the genetic testing. That is going to determine if I have the BRCA1 or BRCA2 gene in my blood type, in my bloodstream, which is what will determine if I have a future risk of continuing to get this cancer or a couple of other types of cancers. BRCA1, BRCA2 are tied to breast cancer, male breast cancer, because yes, men can also get breast cancer, ovarian cancer, prostate cancer, and a fifth one, which I think was pancreatic cancer, but I'm not 100% certain. But this will test if I have those. And that is a big factor in determining course of treatment. So hold that thought. Next week, I'm going in for an MRI. That is going to be a bigger picture of the whole breast area. I'll move this down. So sorry for the TMI, but right now the cancer is here. I have a spot in my left breast, right up here, which is where it is. And yes, Alex Ross Wonder Woman shirt, totally wore that today with my full-on bracers and the shiny tiara. Not shiny right now, but you get the picture. Anyway, right here, this lump can be taken out and removed, but what the MRI will determine is if there is cancer in the lymph nodes around it, or if there's anything in the rest of the breast tissue that was not caught on the mammogram. So that's useful information too. So those two pieces of information will determine what the actual surgery is going to be. So if those two both come back negative, if there's no other spots on the MRI, and if it does not look like it has spread to the lymph nodes, and if the blood test comes back that I do not have that BRCA1 or BRCA2 gene, which will continue to expose me to breast cancer, then, or you continue to have my risk of breast cancer, then I can go ahead and my choice, either a lumpectomy, which is where they just take this piece out with some healthy tissue surrounding it to make sure they got all of the cancer cells. And then that is generally followed up with radiation just to make sure that they're cleaning everything up. Or I can have a mastectomy, which means I can just have this whole breast removed. It's called a bilateral mastectomy because I would still have this one, but I would have this one removed. That does not require radiation because you know you're getting everything because you're just removing the whole thing. Either of those, I've been told by the surgeon at this point, have an equally good chance of success and survival. So it's my choice either way. If the MRI or the genetic tests come back positive, which means there's more cancer, or there's a greater risk of me getting this again, and again, as I, for the next 40, 50 years for which I would like to be alive, then it leans the scales towards having a mastectomy. Because the lumpectomy is like one and done. You can have one, but you can't keep having lumpectomies. Like if I continue to get breast cancer for the next 30 years, they're not going to, like, every 5 years give me a lumpectomy. That's just reasonable. So these pieces of information are very important to have. And once they have those pieces of information, then that is actually, that's where they start, that's where the stage starts to come in. Because once they know how advanced it is, if it's more spread. The other piece, though, that I learned today, which is really interesting and cool, is that when the tumor comes out, either by the lumpectomy or the mastectomy, they send that tumor to a lab, and there's genetic testing done on the tumor itself. And this is apparently fairly new, which is what makes it really cool. So they do DNA testing on the tumor itself, and that's where they find out exactly how nasty it is. So the cells in the tumor can say, this is Grayson, by the way. Cells in the tumor can say, yeah, we're really angry, nasty, evil cells, and we're going to continue to proliferate. So in which case they may do a more aggressive course of radiation or even maybe chemotherapy. Or the cells can be like, we're here, we're cancer, but we're just going to chill. And then that would be, that would mean less aggressive course of future treatment. So all of those diagnostics and all those things that I just talked about are what will ultimately determine the stage of cancer that it is. So, I don't know what stage it is, but it is early and it is small. So those are both good things. What else? So that was useful information that I got today. It was also just sort of a meet and greet, and for me to ask her any questions that I had, which of course I had 1,000 questions. And the oncologist was she was very open, very forthright about stuff, and very very cut and dry. Explained everything very thoroughly, which was great, and I did like her. Anyone who actually knows me out there, anyone who's watching this knows that I myself personally am I'm an herbalist, and I am very much into holistic non-toxic lifestyle and you know, healthy eating, supplements, all of that. So I lean much more strongly towards holistic therapies and treatments. Um, so I was asking her about integrative medicine and integrative treatments. Now, before anyone gets crazy, integrative medicine is a thing that is a combination of both conventional standard treatments like surgery and radiation, and also a holistic approach, which looks at the body as a whole. So it doesn't look at just the cancer, it looks at everything else that's going on in my body, my immune system, any other, chronic issues that I might be having. And I actually plan on doing a whole separate video on that. And like, basically talking about issues that I've had and things in my body and how I feel like I got to this point. So the holistic picture looks at all of that. And so the integrative approach works those two together. And one of the largest centers for integrative cancer treatment is the Dana-Farber Cancer Institute, which is the big name hospital. So that right there should tell you that integrative medicine is not hokey witchcraft, which because a lot of people have said to me, "Oh, I hope you're not going to just do all that, stupid herbal medicine." It's not stupid. It is valid and it is integrated into regular cancer and just in general. Integrative approach to medicine is not just to cancer, you can approach everything that way. It's basically the best of both worlds. It is holistic nutrition, um, more traditional medicine mixed equally with modern science and technology. So, the Dana-Farber Cancer Institute, I am very fortunate that for those of you who are out who don't actually know me, live in Massachusetts. I'm in the western part of the state, hence Western Mass Wonder Woman. And so the hospital that I am going to is really good, but they don't have a full integrative medicine department. But they're part of the umbrella for Mass General. And Mass General works with both my hospital and Dana-Farber. So it's kind of all part of the same network. So I was asking my oncologist about some integrative therapies and approaches that I had seen on the Dana-Farber website. And she just came right out and said, "Well, why don't you go to Dana-Farber for a second opinion?" And a second opinion is not a bad thing. It's actually a great thing. And she very much encouraged me to do it. Because a second opinion is not saying, I don't trust the first doctor. I want to hear what someone else has to say. I mean, it certainly can be. But in this case, it's not, I don't trust the first doctor. It's this hospital doesn't offer all of the treatments that I am interested in for my health journey. But this other hospital is. So again, I can, it's looking at the best of both worlds because I can have both opinions and both cancer teams. And I heard from both ends when I talked to both of them today that they very often work together. So Dana-Farber does work with the smaller local hospitals as long as they're part of this whole network. And so it's a back and forth, which is fantastic. This is like exactly the approach that I have been hoping for. Because again, I'm a very holistic minded person. I try to do natural treatments, as much as possible for everything all that is reasonably possible. And I really just did not want to go straight on conventional medicine when I know that there are so many other supportive therapies that can be done in the integrative world. So after I had my first oncologist appointment today, and then when I came home, I then called Dana-Farber and got an appointment there. So I'll be seeing them in 2 weeks, which will be right around the time that I might be being scheduled for surgery. But that's still okay because, again, the teams are willing to work together and sort of create this whole like bigger picture for me. So it was actually a really positive information that I got today about this and about the approach because, um, like one of the scariest things for people is often not knowing, like, not understanding the medicine, not understanding the the science behind this all. I'm fortunate. I spent a number of years as a veterinary technician. So even though animals aren't exactly the same as humans, there's a lot of commonality. Like, cancer in an animal is cancer in a human. Um, so I understand a lot of that already. I already have a lot of that background, and then plus all of my own years of personal research as an herbalist and studying the body and health and nutrition, and going on my own health journey prior to the cancer diagnosis. Um, so I understand that pretty well. And that helps to alleviate a lot of fear. And unfortunately, I think that's a problem that a lot of people have is not understanding the science and the medicine and the therapies. So, if anyone is out there who is confused and scared and struggling, I strongly encourage you ask every single question, because the only way you're ever going to feel safer is if you have the answers, and you can't get the answers if people don't know you're looking for them. So please, anyone out there who's going through a cancer journey, who is, struggling with information, ask and talk to people. Every person that I have spoken to so far, for every level, from not just friends and family, but everyone on the other end of the phone in any of these offices that I've now been dealing with, um, my work people, at, just everyone. I mean, I was talking to the guy in the grocery store about it. Um, People want to be there for you. They want to help you. No one has to go through any of this alone, and no one should go through any of this alone. And I don't care what your personality type is. You need a support network. You need a team, not just of doctors, but of everyone. And you need to ask the questions. You need to get this information, because otherwise you'll never be right with it. And so please, please, please do that. Information, knowledge is power. I mean, that's a meme for a reason. So that's probably all I have to say about that right now. Um, yeah, so this video has been pretty long already. Just just wanted to give everyone an update on that. Um, yeah, so I will be doing a couple of other videos. There's definitely some other things that I want to talk about, but I don't want to do like whole long, like 2-hour videos, because especially with the quality of the videos that I'm doing right now, no one wants to watch that. So I think I'm going to end it here. And I hope that this is useful information for anyone who is either wondering about me, or struggling with their own, questions about cancer and about the, oncologists and how that all works. Um, and yeah, so that's it. So this is video 2 of the cancer journey. Um, Medical update. Things are going in the right direction. Um, and so I'll be back a couple of days, another week, who knows when the mood strikes me to do the next video, and when I have slightly better way to do it. So thank you all for watching, and take care, everybody. Stay strong and have a good night.